All right. Good evening. Welcome to the March 18th, 2025 meeting of the Everett Planning Commission. Ayana, would you please call the roll?
Chair Chatters.
Present.
Commissioner Adkins.
Present.
Commissioner Finch.
Here.
Commissioner Sullivan.
Here.
Commissioner Shelby.
Here.
Commissioner Rutledge.
Here.
Commissioner Welch.
Here.
Thank you.
Thank you.
Could we hold this open for like 20 seconds?
Absolutely.
No.
And Commissioner Ballard, welcome.
Just in the nick of time.
You want to utter a quick here for us, Commissioner Ballard?
Here.
All right, perfect. Thank you, Ayana. Let's see, Commissioner Adkins, if you wouldn't mind reading the land acknowledgement.
Yes, the Planning Commission wishes to acknowledge the original inhabitants of this place, the Shtahopes people, and their successors, the Tulalip tribes. Since time immemorial, they have hunted, fished, gathered on, and taken care of these lands and waters. We respect their sovereignty, their right to self-determination, and honor their sacred spiritual connection with the land and water. We will strive to be honest about our past mistakes and bring about a future that includes their people, stories, and voices to form a more just and equitable society.
Thank you. Everyone has had an opportunity to look at the minutes from our March 4th, 2025 meeting. Are there any corrections that anyone would like to offer?
No correction, but I know the meeting was brief, but these minutes may be even more brief than the meeting itself. I don't know if that's a style we're moving toward, but I seem to remember a more robust conversation than what I'm seeing here in the minutes.
Do you have a request that that the staff maybe take another pass through and see if there was more substantive conversation? Do you have a suggestion around a particular segment that you think would be good to focus on?
No need to go back, but I think going forward, I just recall there being someone other than myself talking at the meeting, and there's more formatting than content here.
Noted. Thank you for your comments on that, Commissioner Finch. Do we have any corrections for the minutes? Okay. Any objections to approving the minutes as they stand? Okay, without objection, the minutes from March 4th are then approved. Thank you. Let us now move on to commissioner reports. Commissioners, is there anyone who has a report for us this evening? Okay, we'll turn it over to staff. Thank you.
All right. Good evening, commissioners. York Siemens Wajda, planning director. Steadily working through the elements. We've got two of the last elements of goals and policies on your agenda this evening. That leaves only one after this evening, which is public facilities. Working with other departments on that, and we'll get you that either at the next meeting or very soon. Wanted to catch you up on a couple things with council. We had a built environment committee last week. The built environment committee invited LISC, Local and Initiatives Support Corporation, to come give a briefing on the work that they've been doing with the city and with partners in Casino Road, working on engagement, affordable housing strategy, and an economic development work plan for that neighborhood. I joined that meeting to provide a little bit of staff context around what we have done with some of the recommendations that they've made. You'll remember from a meeting 2 months ago, maybe, that Alex Brennan and Tina Vlasity, and I think a couple other folks came to cover a memo with some recommendations on the comprehensive plan with this planning commission. We made a few edits to the housing element, especially based on those recommendations, and that was folded into the council early review draft package that was shared in February 14th about, I believe. I shared with you a quick response sheet that went through all of the specific action items that were part of the memo that we discussed at this planning commission meeting a couple months ago, and where what staff had done with each of those comments. Some of them were taking and made the change. Some of them we had some explanation as to why we felt the change maybe wasn't needed or it had already been handled in some other way. And then some others in there. You've only had a few minutes with this. I don't think we need to go through point by point, but that offer is on the table if the commission would like to. Otherwise, you can see kind of what we've done. It's both instructive a little bit on how we work with the policies in this phase of amending or modifying or tweaking some of the work that we've done previously in the year. And then also it's something that this commission was interested in. I think the biggest topic is that we are working on fleshing out a proposal for inclusionary zoning in South Everett, the area that is highlighted as a high displacement risk in regional displacement risk mapping exercises. This was one of the recommendations from LISC, FutureWise, and the Housing Consortium. So we revised a policy pretty simply from explore to implement. And that's how the policy stands right now. We'll hear tomorrow from the council if that's among the issues that they would like to take up or change. I'll draw your eye to that. Most of the rest of it are pretty small scale changes in wording. There was some discussion about concentration of poverty and that tension between not wanting to concentrate poverty or affordable housing or subsidized housing, yet not wanting to the avoidance of such to result in displacement of a community that exists there. I think we all acknowledge the difficulty in threading the needle on that, made some policy changes. And then maybe the other one that was kind of interesting and it's still in play a little bit is a discussion on mixed use zoning or opportunities for small scale commercial establishments along West Casino Road. We have a couple of arterial intersections that have a neighborhood business zone right now. Those are identified. You see this on the last page in the draft zoning map. Those have been changed to mixed urban zone, which allows the full suite of commercial uses. We also have the neighborhood commercial framework that we shared with you months ago. It hasn't really changed since the memo that we went over. If you remember that when we were talking about land uses, we've started to write that into code and put some specifics to it. So with the combination of the neighborhood commercial, which provides some small scale up to 3,000 square feet on corners, which we are, I think, interpreting as public road corners, but that is still something that we're discussing. And then those mixed urban zones, there is some opportunity for small scale commerce on West Casino Road. I think, actually, now that I'm remembering it, didn't we add Casino Road?
As of yesterday, yes.
We did yesterday, actually, just to take another look at this. We had been a little bit equivocal or unclear as to whether what a corner lot would be and whether private roads would count. And I think that was part of the question here. This is a corridor that over 1.5 miles only has 2 public road intersections, so there aren't many corners. It's somewhat rare in being relatively intensely developed, yet residential zoning. Most of our other arterial corridors are mixed use, so you already allow all the commerce. So I think we looked at all of the different places in the city and would it make sense to call out Casino Road specifically? And we thought that it would make sense. And so wrote into the latest draft, which we'll share soon, that corner lots or lots adjacent to Casino Road, I think we had.
Fronting on Casino.
Fronting on Casino Road, yeah. So that you would be able to have those small scale up to 3,000 square feet neighborhood serving commercial uses anywhere along that corridor, in addition to the more wide availability of commerce at the intersections and of course at Evergreen Way. So that you see the code sections here, a proposed 1905-045 in your mind, you can add to that corner lots and lots fronting on Casino Road for the latest proposal. We will see how that evolves and we will check back in with you. Any questions on the Casino Road list future-wise work? We'll come back to you when we kind of bring it all together in the next couple of months for another touch point on that, but thought it was a good time to give an update.
I know that a central proposal was around delaying zoning changes. How did that discussion go? Was it by kind of agreement that the folks in that area worked their way around to, because I see you're recommending not to delay changes. Did the folks work their way around to sharing that perspective, or is that still being debated?
I think there are two aspects to delaying zoning changes. One is the underlying zoning. And then the second is that we will be doing a sub-area plan in association with the TOD, which may bring a little bit more clarity as to what it means to be a center and how that works, and have it in coordination with the plans for the light rail station. So what we are saying is baseline, we are really not changing the zoning in that area, because what is commercial will still stay mixed use commercial, and what is residential is literally only changing to the comparable residential right now.
Okay.
So there really isn't a change. So in a way, yes, we did agree, and in a way, yes, we did not agree. So,
But it sounds like there's more clarity around that
Mhm.
issue.
right.
Okay.
I think the exploration and potential implementation of mandatory inclusionary zoning really helped too. That was one of the main reasons they wanted to delay, was don't, excuse me, you may miss an opportunity that's only available when you change the zoning. And if we're going to do that now, then that took one of the main reasons for the delay. So I think the team will be watching that affordable housing work group team.
Commissioners, questions on this, comments, input?
Does the drive to limit neighborhood commercial only to corners, is it really just to avoid parking issues? Or, I mean, what is, because from what I have heard from others is that they would love to have neighborhood commercial, but they may not own a corner lot, and it seems like we're providing an unfair advantage to business that happens to be on a corner lot.
We are limiting it to corner lots because they would have a limited impact on a block face in an existing neighborhood. We are also using historic buildings that were commercial, and it doesn't matter where those are. So if it was a historic storefront that was in the middle of the block, and you can tell that it was a historic storefront by the look and scale of the building, or that you can show it was at some point, then that is perfectly fine. So yes, it's for limited impact on the neighborhood. It does have impact on parking. It does have impact on a whole host of things. But yes, that's why it was starting with the corners at this point.
It also fits the pattern of where commerce usually likes to go, because you got two directions that people can notice you from. We're, I think, proposing sort of a middle ground. We've had some questions from council members. My next piece was going to be, we're meeting with the council and have gotten a couple of questions, and that was one of them. Both just to help me understand this new concept, and then also some hesitancy about all corners. So there may be a call. We'll see where the council is at potentially tomorrow on that, to limit it to corners that have at least one minor arterial. That would be going the other direction from all lots. So I think there's a good case to be made for both directions. For maybe it's something we ease into too.
Do you expect a lot of demand for corner lots?
we expect very little demand for corner lots that are not on at least a minor arterial. Minor arterials are things like Beverly and
Right.
19.
So adding that language is not
don't-
highly beneficial if there's already not any planned demand.
But there are some arterials that if you were to add it, not necessarily on corners, are in the middle of a residential district, so
Mhm.
that would be.
And so you could
Mhm.
foresee some opportunities for maybe a developer to want to do that, which is why we might want to, we're considering adding some, like, we're going to have a dialogue about adding some language to limit that scope.
Mhm.
Is that what I'm hearing? Okay.
Yeah, I think I don't think we don't think it's going to happen as a compelling argument to allow something that you wouldn't want to happen. So the question is, if there is a demand for it, is it a bad thing if it were to site there on, and we're talking about whether it's mid-block or on a two very small, the intersection of 147th and 22nd or something like that.
Yeah.
Um,
You're right. 'Cause
would that be a bad thing? If it's not a bad thing, then it's no problem to allow it and we'll see where the market decides. We do expect for the most part, if you want customers, you don't want to be very hidden.
Right. Okay, that's fair. Yeah, I mean, that was my point. Like, are we withholding somebody's ability? But it doesn't sound like that's really the case.
Right.
Cool, thanks.
Did the council report receiving any feedback on that or on that issue from the community?
Not that I've heard, but it
Okay.
could be. Yeah.
Not in the meetings we've been at.
Okay.
Right.
Okay. Additional questions on that topic, commissioners? Okay.
Couple more.
I think that relative to the definition of neighborhood commercial as proposed, given the breadth of the potential uses, I would think pretty hard about where you allow it to happen. To me, a small scale daycare, family run daycare is quite different than a vet clinic or a butcher shop if you are in a neighborhood, whether it's on a corner or not. And let's just say there is significant demand for that butcher shop. There's likely a pretty significant negative externality for those neighbors as well. So I would say just think through not only what it could be, but the nightmare it could also be.
Yeah. We're trying, so much of this is putting on your imagination cap and thinking exactly of that. What is the worst outcome possible? You don't want to plan to only the worst possible outcome. Interesting, you mentioned butcher shop. We had a market study, kind of a regular update thing that we subscribe to that goes through all the different categories of businesses and what we are oversubscribed in and undersubscribed in relative to demand, or how much capacity versus demand. And butcher shop and specialty grocery was one of those that we were short on. So that's if anybody's looking to open a business, that's one apparently you'd get some good demand in Everett.
Can I ask you to tease that out a little bit more about what you're trying to say?
I think some businesses generate a level of traffic and or a waste stream that would be undesirable to live next to. So relative to a vet clinic, sometimes somebody doesn't pick their animal up and they yelp all night. Relative to a butcher store.
People don't pick their children up.
That's right. But I think that, and that happens, right? I think that's normal. But I don't know that I want to live next to a dumpster where the discards of a butcher shop end up. It will never, I mean, yeah, it just, we need to be thinking through the kind of negative externalities we could create for others by allowing this to happen.
Thank you.
Yeah, while we think of the positive aspects, our favorite corner store, a nice place to go get breakfast, we need to think of those too. So do think there is location, there are performance standards like hours of operation, or we have a noise ordinance that overlaps this. Then there's the uses. Are any of those maybe not appropriate?
And I know there's a definition of clinic in the code. I don't recall exactly what that relates to. In this circumstance, what would constitute as a clinic?
We were thinking more along the dentist or the doctor that was a small operation. Because you're limited at 3,000 square feet. So,
But it's pretty much anything with it's medical, surgical, or diagnosis under the care of a doctor. But it doesn't have to be strictly a doctor, so call that a medical professional with.
And would the definition of clinic in this instance also apply to some of the uses that are currently not allowed on the street level in Metro Everett?
Yes, not the social services category, but yes, the clinic category. Which is all, well, there's a list of 6 or 7 that have been exempted from that, but
It would
everything.
not be exempted under this definition in a neighborhood commercial
or
setting.
they could be.
Yeah, I would recommend thinking through that.
Mhm.
And of course, even small scale businesses are subject to the industry safety and health
Mhm.
regulatory standards. So like, for example, butcher shop, I would hope there are standards around a dumpster full of entrails. But surprisingly, in some industries, there are fewer standards than you think. So I think Commissioner Finch's point is well taken.
It'd be a rough July in that neighborhood.
Yeah. Additional on that subject, commissioners?
In defense of butcher shops.
A quick question, if we're allowing commercial, neighborhood commercial, that doesn't make the existing place non-conforming if it's on a corner, right?
Mhm.
I just want to make,
And the 3,000 square feet, that is like the built structure used for the business, not the lot size or
That
like
is
a
the
parcel
built
size?
structure.
Okay.
Mhm.
I think-
Structure or the use footprint?
The use footprint for the business.
Could be the ground floor and then there's other stuff above.
it.
Yeah.
Mhm.
And then the outdoor, that's the other one that's a potential for concern that you have a patio or something. There is an administrative use permit for outdoor use, so at least there's some discretion there.
would an outdoor patio count then? Let's say it's, we'll do what ifs.
Next question.
So I'll do the what if, I what if like a tap room or a brewery, they like to have the outside, let's say as an example, with the outside, since patrons could go out there, does that count as the footprint or not?
My comment would be no.
Okay,
Mhm.
fine.
Mhm.
We should probably clarify that.
Mhm. It was for the building was the 3,000 square feet.
Cafe, because you can go outside.
Mhm. Yeah.
Yep.
Mhm.
This is a thought.
Mhm.
It would probably be tough to fit the indoor portion and still have a sizable outdoor patio, but
Mm.
I'm not great on dimensions.
Or we like to play what ifs.
Yeah, no, that's what we need.
What are we using as the definition of small animal?
It's not horses and stuff. It's in code. I think it is.
There's a large animal vet and a small animal vet,
Yeah.
so,
I think they're commonly kept as household pets.
so Great Danes, yes. Which could be a small horse, but lovable.
I think we're ready to move to the next topic.
That's just a couple others. So again, tomorrow is opportunity for the council to make amendments, and it doesn't have to be that formal, but we give them the early council package. We're looking for any major changes in direction before we wrap up the full draft and send it off to the state end of the month. Looking specifically at things like the map and the policies in those key elements that we shared about a month ago. So far, we have heard of one around, actually, relates to the Planning Commission around West Mukilteo Boulevard and the low rise designation in the UR4. So there will be a motion to pull back the UR4 on West Mukilteo Boulevard, except for the far western end, close to the city of Mukilteo, around where there is a current neighborhood business node. Some recent townhouses were built in the neighborhood business zone and the Soundview Deli across the street. So from Sound Avenue, a pretty small area, but that would be kind of a little node of more residential capacity, but otherwise reverting the rest of that corridor to neighborhood residential. and balancing that with a couple extra floors of height on the 2 parking lots and the machine shop for the old Cadman mine on Glenwood and Kenwood. So a little bit down over here and a little bit up over here is the one kind of clear amendment that we know of so far, but we may have some more that emerge tomorrow. There have also been a couple of questions slash concerns. One of them is where on the zoning map, the height limits don't kind of stair step down from a higher level to a lower level. In almost every case, 15-story zoning is next to 7 or 4-story zoning before you get to neighborhood residential. There are a couple that have some funny stories around, not funny at all, just outliers. One of them is West Mall Place, just north of Everett Mall. It's existing zoning 6 floors, I think, and UR3. It is developed with an apartment complex. We wouldn't expect to redevelop anytime soon, but at the same time, like I said, you want to plan for the future that you want. So questions about places like that, where you have 15-story zoning directly next to neighborhood residential, Silver Lake and along 19th, where the lower density is in the county is another example of that. So we're going to talk about, or we have passed along that we have in the code, height is limited within 50 feet of the 15-story zoning. So if your parcel that is zoned for 15 floors is next to neighborhood residential, then for 50 feet into your parcel, you have to meet the height of that zone. 35 feet is currently. There's also a 10-foot setback from those zone boundaries and a type 1 site obscuring landscaped buffer, trees, dense hedges, or a fence sufficient to block the view. So those are, and then the 10-foot setback and the type 1 landscaping buffer is also required for any interior lot line that abuts UR4 and UR7 zones, so the other residential zones. There's a whole table of adjacency and what different landscaping, height reduction, and setbacks are required when one zone meets another that we can share with you. But at least that was some of the answer, is that we do have measures to soften the transition from a high zone to a lower zone. And then also, if that isn't enough and this is not a good transition to have, then that would be an opportunity to change the zoning on one side or the other.
York, when will we have that table of zone transitions shared with us?
I think in the next, we're talking about that today, how to structure going through the development regulations. I think during April would be the right time for that. It's going to be 2 meetings, maybe 3. There's a lot of material to cover. We've covered a lot of it, neighborhood residential, for example, about setbacks and height and all that stuff, and you can see exactly how it's worded. There's other things like the landscaping chapter we've not gotten into, and we're gonna have to find a way to get through that efficiently. But let's say April would be the time, and when we talk landscaping, and we'll have maybe a unit on transitions and give you that material. We talked about neighborhood commercial. That was another question. There was a question or concern about, we haven't gotten to parking yet, but we will soon. And this council member didn't want less than 1 vehicle or 1 parking space per household if it's more than 4 blocks from a transit stop with frequency of 15 or so minutes. So sounds like maybe okay within those non-transit adjacent parts of the city, that 1 per unit would be okay. Parts of the city that are adjacent to frequent transit, BRT, light rail, and all of that might be okay for lower parking ratio. So that seems like about where we were headed as well at staff, which was a baseline of 1 and then reductions from there. But the council member, if you remember, with accessory dwelling units, we picked up all-day transit as a concept, which I think we all agree that is difficult to live without a car if you've got hourly buses or less. So making sure that the definition of transit adjacent reflects a real level of transit service will be part of that. But otherwise, that seems like about where staff was heading, and that'll also be an April thing. And then in the neighborhood residential zone, a strong preference for requiring front doors to face the street. And we do have that in our draft middle housing regulations. Those are mostly in 19.08, the chapter, and that is in the early council draft package. And there's a requirement that buildings in the NR zone must front either a public street or shared yard space and must include a frontage type on each individual or shared building entry. The frontage types are different types of porches, dooryards, stoops, that kind of a thing. So I think, again, all of those seem like the adjacency thing. Maybe there's an amendment there that might need to be made, or maybe the features that we have to soften the transition are enough. Otherwise, it seems like we're in about the right place. This is 1 out of 7 council members, but we've heard similar things on a couple of these from other council members as well. That's a little preview of what we'll cover tomorrow, but all of those things you've talked about here. So I thought it was worth sharing.
The front door thing, commissioners, do we recall that conversation? I think that had to do with the potential of building housing that was alley adjacent on the back end of property when we were talking about potentially segregating property. Am I remembering that correctly? That was, how did that issue play into that preference that the front doors be facing the street?
We are being that fronting on an alley and life on an alley is something that we think is something that we should look into as a city. That we have a lot of alley frontage and we have a lot of rows of houses on the street that it makes sense that you build. There's room for more structures along the alley. Fire is requiring a walkway and that there be a clear orientation to the street. That's something that we'll need to cover. We need addressing, and there's historic regulations in some areas that require that the units be visible from the street. For the most part, what this is about, I think, is avoiding sideways developments where you have a driveway kind of thing, auto court, and then units facing that and only that. So when you're walking down the street, you see big broad side and a driveway rather than front doors. Whether it's allowed to have something in the back or not, I think that's where the shared yard would come in, and that could be compatible with an alley loaded structure.
Commissioner Shelby, you had a question or comment.
Oh, I was curious, back to the change in West Mukilteo. Is it east of Soundview? Are you going all the way potentially then to Dogwood, where it becomes
All
West
the way
Mukilteo?
to the rest of,
So that, I mean, that kills that neighborhood center at Beverly, Dogwood, and
maybe not.
West Mukilteo. I mean, that if you make that change, that's half the neighborhood center gone.
It goes to Glenwood.
Okay.
So not all the way to that little MU4 cluster. That's still in there. So it'd be just the neighborhood residential from Glenwood to Sound.
Okay. Relative to alley development, are alleys in Everett different widths?
It must be, but I think for the most part, about 25 feet.
Okay. I agree with your approach to activating alleys. I think that long term, I would rather see lots being split in half as opposed to flag lots for a number of reasons. I think both homes live better like that. And so if there's a way to thread the needle with the zoning that provides for alley frontage, presence on the alley, maybe if alleys are improved and if they're over a certain width, that's maybe a first way to activate the low-hanging fruit in alleys.
Idea.
And in theory, can you have frontage, I guess frontage and rearage? I don't know the name of it, like.
I mean, you could.
Like you have it facing the road, but then you could also just have like a really nice back porch that faces the alleyway. In it, like in a current ADU, right? I mean, you just do both, right?
Yes.
To be compliant. Okay, I'm just making sure
Yeah,
that I'm
no,
following this,
right.
because I also think it's a good idea, but
We agree.
I love that for both of us.
That's it. Those were kind of the key issues that we've heard about in advance of tomorrow's council meeting. We'll report back on the outcome of that.
Okay, anything further on those topics, commissioners? Okay, then I think we're ready to move on to agenda item 4, healthy community element. So, oh, I'm sorry. I should ask if there is anyone who wishes to offer public comment before we move on to agenda item 4. Oh, okay, thank you. Okay, we're ready to move on to agenda item 4.
So healthy communities, I guess, is an Alice creation of sorts. When you look at the Growth Management Act, I mean, as a whole, the whole point of the Growth Management Act is to create livable communities, not to encroach on our natural resources, as well as to use our resources wisely and to connect our communities together. And when the act was initially developed, it probably wasn't thought of in terms of healthy community, but since then, the whole aspect of a community being healthy and the ideas behind zoning being more integrated and mixed use has changed dramatically. And so when you look at the 2016 plan for Everett, there are literally 2 places where the health is mentioned. One is in a healthy environment and the second one is in a healthy economy. We don't mention people at all. And if we are not doing this for the health of the people in this city, my comment is, why are we doing this? So there are a whole host of goals and policies that we have written into other sections of the plan. Our land use section, our environmental section, our climate change section, our transportation section, our housing section, our parks and open space section, our economic development section are all aspects of health, because without all of them, we still don't have a healthy community. So what we were pulling together here was items that impact the health of the community in the global aspect of health, not just not being sick, but what makes us a good place to live, to breathe the air, to be able to walk from A to B that is safe for us, that we are taking care of those amongst us that are not necessarily able to take care of themselves. And we are working with other agencies to make those things happen together. So in putting it together and looking at it, we've worked with our community development department to come up with these 6 goals. And you've all read them. And then the 16 policies to enact them behind it. So healthy communities is brought up in Vision 2050 in separate segments. Again, it's very split out, but not necessarily brought together as a whole entity. The same thing with the metropolitan planning process and the Snohomish County goals. And then the state of Washington has its own Washington health guidance, which goes a little bit more into health and epidemiology than what we would have responsibility for here. So with that being said, I am open to conversation as to where it came from, how we put it together, and to discuss in any of the questions you may have.
Yeah, so in another role, I serve on the Puget Sound Clean Air Agency's Advisory Council as the Tribal Nations representative. And something that I was very shocked to learn about a few months ago was that Everett as a whole is considered an overburdened community with regards to air pollution. So I just wanted to thank you for including talking about overburdened communities in goal HC2. But I was wondering if in goals HC 15 or HC 16, if there's a way that we could kind of implement more of the language from the goal into the policies.
We could try.
And just because I would love to see, and I don't know if if this document is exactly the most appropriate place to put it in, but I would love to see it just somewhere in the document on talking about just kind of the unique challenges that Everett faces as one of the 16 overburdened communities in Washington State. That I feel like this isn't necessarily pointing out that we as a city are particularly affected by air pollution.
And that would probably go more in the text of the document rather than recognizing the state of air quality in Everett currently and that we are working to improve it is definitely part of it. And it is also reflected in the transportation goals too. Mhm.
One question, oh, I'm sorry, were you about to? Okay. One question I had about the goals section. There are several that reference Everett households having access to something that is an element of health. And I don't even know if this would be necessary because there are other sections, but what was coming to mind for me was non-car dependent access. And so I don't know if it would be useful to articulate that specifically, that because access to a lot of folks who have the privilege of a car, they don't think about non-car dependent. And that is actually a serious challenge for some of our most vulnerable families, is not just the access piece, but the non-car dependent.
I can say that
access.
earlier drafts had it within the neighborhoods or within walking distance that got through edits.
And
We
it
can
doesn't
put that in.
necessarily have to be walking distance, but because this ties
Or
into the
close
transportation
proximity.
element. And like Commissioner Adkins has pointed out to us many times about access to Howarth Park in particular. So this has to do with our public transportation as well,
Mhm.
which is why I'm not sure if this needs to be kind of hammered home in this section, or if it's picked up in other elements of transportation, or I don't know. Commissioners, what do you think about that?
I mean, it can also be into this section that saying access means that you can get to transportation, you can walk there, you can use active modes to get there safely. And that can also be in the write-up leading to it. So.
Thank you.
Because I do think that it needs to be underscored, the idea of it, like our dependence on cars is making us unhealthy.
Mhm.
And that if we're talking about healthy communities, like making sure that people are able to walk is, of course, one of the most simple ways that we can increase people's positive health outcomes.
I think one of my general comments when I was reading through this was for that goal HC5. It felt like there weren't many policies directly addressing that goal as opposed to some of the other ones. And so maybe that ties into part of the conversation too.
Mhm.
And similarly, I did kind of do a little cross-reference of the transportation element because I also thought that was a really important element to make sure that we're making active transportation a priority, as that does really play into healthy communities, and making sure we address that in all those different elements.
Speaking of HC5, is there a different word we could use other than affordable?
Which,
HC5 have access to safe.
It has access to safe and affordable physical activity.
Yeah. The term affordable just seems odd to have when describing physical activity.
Part of it, I think.
part of it is a very real thing because we have a parks department that does not offer recreation. I mean, so opportunities for people who are of limited means are really limited in this jurisdiction. And scholarships are even more limited because we have a parks department that doesn't offer recreation. I mean, in the parks plan, one of the quote recreation things that they highlight is the number of park benches. And I was amazed, quite honestly.
Yeah, I guess trying to get down to my
Picnic tables and park benches.
trying to get down to why exactly I feel uncomfortable with the use of the word affordable. I guess I just don't like the idea that like the physical activity incurs a cost no matter what. And that putting affordable implies that like you're going to spend money on it. But I don't have an alternative word to use up either.
You
Like,
could remove the word. It doesn't have to be there.
Yeah.
It's superfluous, really. If you think about just a physical activity,
Hmm.
why does it affordable even need to be meant? That part doesn't even need to be mentioned, really. Could just remove it.
Well, I guess affordability is a component of access.
Mhm.
It's also subjective.
yeah, because
What's
like,
what's affordable one is,
I mean, even a $5 charge to like a $5 monthly charge for a gym, that could be affordable, but still be a barrier to access. And so I feel like I see what the word, having the word affordable there is meant to be saying about how we approach this, but I just feel like there's a better way to say that, because ultimately, at least from my perspective, like we would want every Everett resident to be within easy walking distance of free physical activity they could participate in.
Yeah, I think free definitely fits under affordable. It is trying to make sure that not every opportunity is behind a paywall. So you have either, whether it's parks or trails for walking, running, and that kind of thing, or
Swimming. I mean,
swimming, or if our recreation approach does rely on private partnerships, but part of that approach includes, as I understand it, set asides and requirements for community access. So it's does get to that. I found where it came from. One of the key documents that I think Alisanne mentioned is the Washington State Plan for Healthy Communities. Under Domain 2, Environmental Approaches, Strategy 1 is increase access to safe and affordable physical activity where people work, learn, live, play, and worship. I think I couldn't figure out how physical activity and places of worship connected, so I did not include that piece. There's also a reference to tobacco-free that seemed more detailed than was necessary for the comprehensive plan, but otherwise that's where that strategy came from. We try as much as possible, if things have already been vetted by professionals in the industry, to just pick that up.
Well, if it's good enough for them, it's good enough for me. So
But if it's not hitting the right tone, I mean, it sounds like we agree on the concept that if you have limited means, you should still have the ability to find physical activity. So it's more that maybe affordable implies that there is a cost rather than, yeah, okay.
I agree with Commissioner Atkins. I would also advise to remove where they work, live, and play. I think the concept here is we want unfettered access to publicly available outlets of activity. And so the implication of work, live, and play seems to fall on potential developers adding costs to projects that would otherwise deliver units and or office space that does a variety of things to the community in other ways. So by making these public spaces and prioritizing that, I think it's implicit they are without cost and barrier free. So that may be one way to address that.
yeah, that sounds perfectly like what I was trying to get at. Because when I think of like safe and free physical activity, I think of like, well, the park, just an empty field near your house that maybe you have your kids go and play soccer at or whatever. Versus putting the word affordable makes me think of, oh, well, maybe the city's going to get a real good deal on the new contractor for the new swimming pool or something. And then I only have to pay $5 a month to use the swimming pool because now it's affordable. I don't know. That's
That's a good comment. I'm looking at the version of the materials that I was sent in the mail. It's a fold out, and it may have been revised since then, but I'm noting that goal 5 and 6 are repeated in number. It looks like there may be actually 8 total goals rather than 2 5s and 2 6s. Minor detail, but ultimately you want to catch that. Relative to goals, the second goal 6, goal 8,
Mhm.
Everett is a city that is safe for all residents and visitors. To me, that's a very basic, simple goal that I hope everyone can agree to.
Mhm.
It's unfortunate that it's listed last. I think as it relates to goals, in addition to reader fatigue, I think it also telegraphs the importance the order does. And so I would encourage you to prioritize these goals and make them as simple as possible. I think we just did that relative to the accessibility. I recommend moving the safety component up in the list. On goal number 6, the real 6, we talk about minimal exposure to air pollution and toxic chemicals. While I agree with that, I might recommend broadening that to noise pollution. We have a freeway that runs through Everett, and it's not lidded, it's not landscaped. You can hear the freeway from just about every point within Everett. It's great for mobility, but there's a noise component to that wealthier communities don't have to deal with. And so I recommend highlighting that as a priority in dealing with noise pollution.
Good catch.
I have two, I guess, piggybacks onto that. For the Everett is a city that is safe for all residents and visitors. Would there be a way that we could incorporate that into goal HC1? Because it talks about Everett is a caring community built on trust, inclusion, and equity, where everyone lives in a socially and physically connected environment. I feel like at some point in that sentence, you could have something said where everyone lives in a safe.
Live safely in a socially.
Yeah.
Okay.
And then at least on the part about the real goal 6, people living and working in Everett have minimal exposure to air pollution and toxic chemicals. I feel like goals are supposed to be aspirational. And talking about a minimal exposure to air pollution doesn't exactly scream as this aspirational goal that we want to get to as a city. It screams more of, well, the reality is there's going to be air pollution that we're all exposed to regardless. And so I just feel like that's language that's more suited for the policies rather than the goal itself. Specifically, even just using the word minimal. Like I would feel much better about it if the goal was people living and working in Everett have no exposure to air pollution and toxic chemicals or just.
Or maybe exposure to those elements of air pollution, noise pollution, as Commissioner Finch mentioned, and toxic chemicals at a level that is in accordance with what professionals tell us is healthy or what experts tell us is healthy, or maybe defining it a little bit more.
Yeah, because again,
I'm sorry, I didn't mean to jump on you.
Oh.
I was doing some research just on that I don't know if adding a target, I put on there meeting WHO air quality guidelines by 2040, like setting an actual, I like goals. When I say a goal, I actually like a solution. I'm an engineer. I like solutions. So I saw that the WHO meeting maybe their requirements by a certain time. At least we might not get there, but that's the goal and is, that it's kind of like target 0. You're never going to get to 0, but you're going that direction. So to maybe meet a target,
Yeah.
and WHO would be a international organization of air quality, say.
because if we're talking about the brand of Everett, and I just shared earlier that like we are one of 16 overburdened communities for air pollution in the state, it just feels like we're almost self-dunking on ourselves to be like, well, Everett, we're overburdened. We have a lot of air pollution. So our goal is to make it be not the minimal amount of air pollution. When these goals, again, they should be aspirational. They should be the city we dream of, not the city that we begrudgingly go, well, it's okay.
I agree with you. I think that what we were trying to get to is that there are some levels of air pollution that we have absolutely no control over, forest fires.
Yeah, and honestly, just us living in a large metropolitan area with
Right.
mountains on both sides.
And water and inversions and all those wonderful
Yeah.
things. Mhm.
I really love Commissioner Welch's suggestion to tie it to an actual scientifically accepted metric.
Mhm.
I think that is a wonderful idea, if possible. But is that picked up in the environmental component?
This
Okay.
would be the place when we're
Mhm.
dealing with exposure. There may be other transportation and others, we talk about production of air. Puget Sound Clean Air Agency regulates and has a strategic plan to, it's
Cut VMTs and to
there's-
get electrification and.
there are
other things.
measurable objectives.
Mm.
Exposure brings in, did a lot of learning about this in the last couple of weeks. I've also do some work with Puget Sound Clean Air Agency, so kind of hear about this a lot. Micro scale, the amount of pollution that's in the air varies within a number of feet of a major arterial. We have within 500 feet of a roadway, over 100,000 average daily vehicles, which is our freeways and Evergreen Way pretty much. I don't think any of the other arterials get up to that level. That is a threshold at which there are more noticeable or significant risks to health. So what happens throughout the whole city is different than what happens right next to one of those major corridors. We were thinking about how to reduce exposure. So I would look to the transportation element and and outside of the city, we're limited in what we can do on the vehicle fleet that's in Washington State over the next 20 years. But we can impact somewhat some of the exposure of it. So you look to children and other vulnerable groups who are particularly vulnerable. And we were looking at childcare facilities and wondering if that's something that should be restricted, or play areas or recreation. We were talking about exercise, and do you want to avoid exercise next door to a freeway? Probably, but what if that's the only option? We
Like a
have child.
daycare at a train station, you mean?
Yeah, right.
Mhm.
We have a childcare shortage right now that is itself a significant problem with health. So those are some of the things that we were kind of balancing, and I think one specific thing that we proposed, where we require common and open space and active recreation as part of a development, require about 75 to 100 square feet of that per apartment in multi-unit developments. Some of that is playgrounds, and we drafted into code a requirement that be as far from Evergreen Way or a freeway as possible, if that's where your site is. Beyond that, what to do, and we would love to hear some thoughts on it. I do think that goals should be in the realm of achievable. I don't know what I would say to something like Vision Zero, which unfortunately we are not going to hit in 2044. I don't believe. Is that, do you want to start giving up on that? We're trying to make these goals all what we intend to achieve and what we believe we have the ability to achieve. And a zero air pollution Everett is just not possible. We don't control enough of it. And even if everybody was aligned, I think that would be difficult. So that's why we landed on minimize. We think it's more important to have kind of the measurable objectives that over time you have accountability towards your goals, rather than having a set of goals that are maybe so aspirational that they get ignored, and it's easier to do away with them. So a couple of the things that we're thinking through on that, but I strong agreement on the importance of the issue.
Yeah, because I just feel like minimizing or minimal, that potentially allows people in the future beyond us to look at it and go, well, we're doing the bare minimum, or like not bare minimum, but we're doing what we feasibly can to minimize it, and that's it. Like it just feels like the definition of minimal exposure could just be what we have right now.
Yeah, I mean, we read it as at every turn, try to drive that number down with every tool that we have. It's a tough one. Diesel particulate pollution, I think, is the number one culprit in terms of air pollution. It's chiefly trucks and other heavy vehicles.
Yeah, and just being next to the port, I-5, just so many things culminate in that, like we are just going to be in a place where we are going to have more air pollution than the communities around us,
Right.
probably regardless of what we do.
Puget Sound Clean Air Agency does prioritize those overburdened communities. That's one of their metrics and their goals, is that they spend half of their time and energy on overburdened communities, and that more reduction in pollution is felt in those communities. So that there is, on a regional scale, we are getting some help there. Obviously, everything we do, if just about the whole community is overburdened, everything we do is supportive of that. If anybody is interested in air quality and planning, Bellevue had an excellent report, very accessible, synthesizes the science, and there's links to other information. Bellevue Air Quality and Planning or something like that. You'll find it on Google.
And yet they didn't include it in their comp plan.
Yeah, that was the interesting thing, and I don't, I'm not gonna read all of Bellevue's plan and code, but I'm not sure what their answer was. I have not found that any jurisdiction, not that I've know how to search perfectly, but I've not found any jurisdiction that prohibits childcare next to a freeway. There are plenty of policies that say you should try not to, but nobody has said don't.
Wonder if that's a function of just how limited access to childcare is right now.
Sure. Yeah, there's a lot of parcels that are not on Evergreen Way. But maybe not the right one.
Commissioners, were there any policies that jumped out at you that you wanted to discuss further?
I wanted to ask about HC9 and how that came to be, and mentioning that specific demographic, and pose the question of why maybe older members of our community, which I think is a really vulnerable population, a lot of times was not included.
It was one of the many, I mean, yes, older people are a vulnerable population and we probably should include them. And there probably is a way to add that, not necessarily on 9, but create a senior population.
I think relative to HC9, I think it's an important concept. I find the language a little odd, encouraging young adults to find acceptance with mentors, apprenticeships, and leadership opportunities. We're putting it on the people that probably need to be reached out to, rather than making them do the reaching out.
Well, it's the school districts, universities to provide programs to support and encourage young adults. That's them. It's not the young adults that to find it.
Understood.
Mhm.
I think there's multiple populations out there, the mentors, not the mentees, that also need to be encouraged and referenced in a goal like this.
Okay.
So, on HC 14, collaborate with Everett and Mukilteo school districts, other educators to assist in promoting and accessing lifelong learning from early childhood to adulthood. I would love to see that prioritized higher in the list. And then HC 12, support efforts to ensure the safety and well-being of unhoused people. I would broaden that to all residents and visitors, not just the unhoused.
As well as supporting the prioritizing HC 14, should we also include the community college in that?
School districts, college, university, and community partners.
I was almost wondering if HC9 and HC 14 might be able to be combined. I know they have slightly different elements, but there are some very same elements in both of those.
I would disagree with that. I think HC9, I see the point that's trying to be made there, and I think that there's particularly something to be said about including talk about like community spaces or like third places or something for young people. Is that is a as we see the death of third places,
Mhm.
and of course the rise of social media and whatnot, young people are increasingly feeling isolated. There's all the additional mental health issues, and a lot of that's just driven by how much clubs and associations have fallen, how much third places have fallen, and how for a lot of young people, there's not really places for them to go where they're not expected to spend money. And having been a young person, you want to go find places where you don't have to spend money. And it's not, even paying a few bucks is enough to just make you go, no, I want nothing to do with that place.
So not just to confirm, so 9 has a home with the third place kind of a feel, whereas 14 is more on learning and education.
Yeah, because I find the language around to find acceptance under 9 just strange. And
Well, we're talking about mentors, is apprenticeships and leadership opportunities. It sounds a little bit more like jobby to me.
Maybe that's something we can
Which, either way,
rearrange and
don't get
separate.
rid
So
of the
there
young
is
adults
something
part.
around community building, and then there's something around education and training.
Yeah, I mean,
Education and training is in economic development, but I mean, you can have a mentor that is not necessarily education based.
well, and also like the mentors and apprenticeships, like all that's going into building this feeling of place for young
Yeah.
people. And I feel like that like fits in with the idea of just trying to make sure that young people have things to do and have places to go and can build that community. Because again, I feel like for so many young people, their connection to Everett it's no more than just the address they have on their for where they live. And they don't feel that like sense of community pride that I feel like we need to instill to prevent brain drain.
this is a simple question or silly question. What is a real life example we're thinking of here? For HC9, like what's a
Brothers, big
real?
sisters,
Okay, that's what I'm wondering, like, what are we talking about?
amongst
like-
other things.
Like a teen center.
Mhm.
Like things like boys and girls clubs. There's, of course, Cocoon House is serving a very specific population, but the hub they have, the U-turn center they have for homeless or at-risk youth to be able to go and use and have community and have mentors and have those kinds of employment opportunities in addition to just building that sense of community.
And so that would expand into early adulthood, which I'm
Mhm.
just gonna pick a low number of 25 years old, but I think I can argue that it's all the way up to 29. Are we thinking of that demographic? Because I think there's a wildly difference between 18 to 20 and 20 to 25. So I'm trying to understand who young adults is. I don't want to not mention it because I agree it's not mentioned enough. I'm just trying to tease this out so I can kind of understand what we're going with. At the end of the day,
I think we're
I
being
agree
vague.
with it. I understand. And I know that that's the point. Sometimes it's to be kind of vague, but it's also the point to be able to come up with a real life example. So if somebody asks me, I can tell them.
I remember reading not too long ago in the Everett Herald of this. I think he has sort of a mission involved, but he teaches motorcycle repair and stuff to a whole bunch of youth. And he just sort of takes them under their wing and does this as part of his reason for being in a way, and operates it out of a shop, and it's just a safe place. And I have a distinct memory of reading the article and
Sure.
thinking, wow, that was really cool. Don't know anything more about it.
No, I mean,
'cause
that's
I'm
great.
not a motorcycle repair person,
Totally.
but
Also, I don't.
I don't have my leather, sorry.
Not this time. All right. So by next year, when the comp
Yeah.
plan's done,
Mhm.
I felt like I heard somebody say we should combine 14 and 9. I don't want to do that. I want them separate. I think lifelong learning and early childhood into adulthood is different than apprenticeships and leadership opportunities. Okay, I think that's all I got for now.
I was wondering about HC 11 through 13. They seem to kind of mill around the same subject. Like even
Yes.
11 and 13 really seem almost the same thing.
Yes, except for if you're working with those groups. They're very different, and our community development folks would agree differently.
Take a look at that. then.
But we can look at them.
Yeah, I do agree that I think 12 and 13 could be combined. I do feel like 11, there is a point to be made that, like, we're maybe 11's about trying to stop people from becoming unhoused.
Yeah, I agree. I think 12 and 13 are kind of the same thing. Almost 12's not, doesn't need to be there. 13 kind of covers that, and then 11's on its own because of the difference in mission, I guess.
Yeah, I like
Right.
I think it should be like 11 should be prevention, and then 13's like treatment.
Well, 12 is for taking care of those that are on the street for whatever, not if they, while they're on the street, making sure that they are safe. So, or living in a situation where they do not have a fixed location. Because the violence of those individuals geared towards them is a real problem in a whole host of communities. And then 13 is for working to get them the services. So, because they're a little bit different and nuanced and
One thing that kind of stood out to me is that it was stated in HC4 to assist in the development of community gardens, including on city-owned land. And that there's not really ever, I don't think there's ever been a mention in anything in Everett with community centers. Everett does not have them. And so I don't know if that's something that Everett has ever considered assisting in the development of. It's a real deficit in this city to have no community centers because that has a lot to do with where children can play and where they can go to connect. And other cities certainly have them, but Everett just has no network whatsoever of those things. And I know that we partner with agencies like the Boys and Girls Club, like the YMCA, to offer kids, youths in the city access to those, at some of them free access to those types of things, but it's not a community center. So I don't know that it needs to be included. It's just something that jumped out at me, that we are saying we're willing to assist in the development of community gardens, even using community-owned land, but no mention of actual community centers or community gathering places, which community centers are usable by not just kids. I mean, families use them.
That sounds like some of the conversation, or reminds me of the conversation on HC 11 and 9 and 14. And this third place, that's a community center by another name or a different type of it. But yeah, we'll do some work around that. Not going to be able to commit the city to building community centers, unfortunately. But we can still do as much as we can around that function.
Commissioners, additional questions, additional comments on the policies or the goals for healthy communities?
I have it was just, while we were talking about other things, I was also looking at Bellevue's report. What would it look like if we did an overlay for air quality next to the freeway at X number of feet, and say, like, the building would need to have triple pane windows and, improved building envelopes, high MERV filtration for indoor air quality, move the vents as far away from possible, those kind of things. Those things, you could take actions for future developments. They would incur a cost. I'm not, saying that they wouldn't, but you would improve indoor air quality for those folks and limit, what exposure they could inside structures as well.
We'll do some looking into that. I have to imagine it's doable. Yeah, I'll think about the route. I believe that in the past we started tentatively using SEPA authority to require, it goes more around like window and noise control next to freeways. but we don't do SEPA for lots of State Environmental Policy Act for a lot of housing developments. So a code-based way to do that would be better. Yeah, we'll do some thinking about that.
Okay, Commissioners, last call on healthy communities.
I had one, I forgot, I was gonna mention when we were talking about physical activity, another element to look at is the Parks, Recreation and Open Space Plan. They do talk about trails and access to exercise in there.
If I had a magic wand, I would add a goal of extending the trail system from end to end rather than having it terminate in the middle of the city.
There's that's one,
It's in the pros plan.
yeah, it is in the pros plan. You're talking about the interurban trail,
Mhm.
yeah. So there's a kind of a gap where it turns into Federal Avenue for a while. I think we have, yeah, as soon as we, it'll be a funding thing, but that's the kind of thing you can usually get grants for. I thought I heard that we were gonna start working on some design concepts to be ready for that. We have along the shoreline, I think is a really good story for a growing trail system through our shoreline management program. And when you develop shoreline, and that's riverfront or waterfront, you have to build your part of the trail there. And we're seeing development on the shoreline in a variety of places, and those little, sometimes they're isolated segments that they're starting to get knitted together. And I think it's quite likely that in the planning period, we'll have nearly the whole shoreline covered. I think we got a grant through the Recreation and Conservation Office for a segment underneath where US 2 goes on the shore, on the Snohomish Riverfront. And that is close to connecting to the Riverfront Development Trail, which itself is getting close to the county trail system. Same thing on the north end. So I think there is a lot of really good progress that I'm seeing year by year in the trail system. And I think that interurban gap will get that too. It's going to be the way to get to the train pretty soon.
That's right. Okay, I think we're ready to move on to agenda item 5, engagement, administration and implementation.
So basically what we've done here is, this is how to get stuff done. I guess is the easiest way to say it, and what we need to do to communicate and to implement the plan. And I know you haven't had this for very long. We can read through it, or we can give you a couple minutes, or we can just leave it on the table and bring it up next meeting.
If there was something in particular that you wanted to draw our attention to, that you thought might be something that the commissioners would like to discuss specifically, that might be a good thing.
I think it's just common sense, but at least that's my opinion on the subject. It's sort of
Commissioners,
common sense.
maybe take about 30, 60 seconds and look through it and see if there's any piece of it that you want to address today. And we can always marinate on it and talk about it at our next meeting.
I have 2 comments. One has to do with, I guess, the timely processing of requests, specifically permitting, but I'm sure you could generalize that. I see that goal 7. But it's not the goal, it's under the engagement section.
Mhm.
EAI 7 talks about timely notification. I don't see the timely component referenced anywhere else, but I think that capturing efficient processing of applications, that's important for, the economic health of our community.
It is in economic development.
Okay, all right.
It may, I was gonna look in design and development. I think you're right, economic development.
Economic development is where it is.
Once we have everything, we're gonna do a balancing of so many of these. It's like could go in lots of different elements. It's possible that we have duplicates, hopefully nothing that's inconsistent, maybe better ways to organize it. So before hitting print, we'll make sure that things are both cross-referenced. So if you're picking up this element, you see also this other element in this policy in there.
The other concept, and maybe it's embraced in here in some way, but I keep thinking back to our discussion on the park district. And I think ultimately, my fellow planning commissioners, they bought the idea that there was a required choice between providing that product and where it was sited, that they had to take both. For me, there was zoning in place that already dictated where I thought that project should be sited. Not denying the fact that it was an important use, but rather we had already made a series of community decisions about where projects like that should go. When it comes to implementation and administration, how do we emphasize in the goals that while it's okay to revisit decisions that have been made, we shouldn't bring them into question every time somebody proposes a project?
Durability of decisions.
I think it does a couple of things. It potentially undermines the process and others' willingness to participate in the future. Because what's the point if it gets thrown out when somebody asks a question? The other thing it does is I think it has a potential impact on property values and outsiders' interest in making long-term investment decisions if plans change frequently.
Yeah, that is a tough one. It certainly is, and by design, things like the comprehensive plan are supposed to be durable, and hopefully what we get out of this process lasts for a long while. Everett is in a period right now of a lot of rethinking, and the zoning code has changed too much, in the process of changing too much in a 6-year period, from rethink zoning and Metro Everett to rethink zoning to the periodic update and everything. So I'm hopeful that we have some more durability to this and that we planned it in a place that's going to work for a long time and has broad acceptance. That concept of flexibility versus predictability and durability is so difficult, because when a good idea comes along, and not going to debate the park district, but other things, it's just so hard to say, well, we already made that decision, so don't come back for a while. But I wonder if we could find ways to have more commitment to aspects of it, while allowing that reasonable flexibility in other ways. I think the comprehensive plan versus the development regulations, once we're done with this and it's adopted, it's hands off for at least 1 year. That's not very long in planning terms, but we're hoping that it's mostly hands off for 10 years, and then maybe even little tweaks. This is a pretty big period of adjustment here. Before this, we had pretty much the same zoning from 1956 to 1990s or 2010s.
Additional questions or comments on the engagement, administration, and implementation piece, commissioners? Okay, we have one final opportunity for public comment. Ayanna, do we have anyone online who would like to comment? Okay, with that, I'm sorry, were you reaching for your? Okay. Okay, we have completed our agenda.